Healthcare workers in all healthcare settings should always adhere to the latest World Health Organization guidelines on hand hygiene and barrier precautions before and after contact with a patient, bodily fluids, or patient surroundings. For more information, please watch our video entitled Hand Hygiene. Home Care. Changing a Tracheostomy Tube by Lauren Perlman.
Hi, my name is Lauren Perlman. I'm a respiratory care practitioner here at Boston Children's Hospital, and today we're going to demonstrate tracheostomy tube change here on our little guy, as well as on Drew. Drew and her mom will do a tracheostomy tube change for us in a little while. What we first want to do for this elective tracheostomy tube change is assure that we have two people. So you see me here today, but I have a second person doing this with me. We don't do tracheostomy tube change electively with one person. It's always a two-person procedure. In an emergency, certainly you do what you must to get the tube back into the child for safe transition to spontaneous breathing.
Performing a routine tracheostomy change. Equipment.
We're going to gather some items. We're going to assure that we have a properly working suction machine and that we have a properly sized catheter to suction the tracheostomy tube that's in the child. We want to have a resuscitation bag with pop-off that is properly functioning for us. We want to have a mask that can fit onto that bag in the event that the tracheostomy tube is out, we cannot get it back in. We want to provide the child with bag mask ventilation. The tracheostomy tube change in the home is considered a clean procedure, so I have non-sterile gloves here. The tube itself does come sterile from the manufacturer, as it is an implantable device, so we will not touch the part that will be inserted into the child, but we will use non-sterile gloves. We will have our tracheostomy tube that is the same size the child has in place right now, and we will also have a backup spare tube of a size smaller in the event that we cannot get this tube in. Talk to your physician, your respiratory care practitioner, and your durable medical equipment company about what tubes you should have available for your child based on the tube that they have in their body. Typically, before you leave a facility to go home, you will have all this equipment in place. These are things that you should carry with you in what we refer to as a go bag, so that a child with a tracheostomy tube doesn't travel anywhere without certain pieces of equipment, as well as having them nearby in the home, well marked, hanging right, taped to the bed, or however you prefer to do it, but very visible to those in the home, especially when you have nurses and different care providers coming in and out that aren't necessarily familiar with your home. Make sure the tracheostomy tube is visible, the size the child has in, as well as the next size down, should they have difficulty getting that size in, and other pieces of equipment and supplies that we'll talk about today. We want a new trach tie to help hold the tracheostomy tube in place. This happens to be a Velcro trach tie. There are many brands on the market, and years ago we just had sort of a twill tape or a string that went around the neck, but today we do have nice Velcro holders that are absorbent of moisture from the neck. You will need a dressing to put around the tracheostomy tube to protect and absorb moisture around the tracheostomy tube. Some children, some young adults, some adults choose not to use this. Most of our families initially with a new tracheostomy tube in particular will use a dressing to help absorb moisture until the site heals. You will need some form of water-soluble lubricant that you can dip the end of the tube in to make it slide easily and pass into the stoma site after removing the tube for replacement of it. Scissors have been on the trach tube change protocols for years and years. They're still there. Today we'll be using it to help us trim down our trach tie after we've placed it in. If the tracheostomy tube has a balloon or a cuff on it and needs to be deflated to be removed, you'll need a syringe to do so. You'll also need the syringe to test the tube that you're going to check before you insert it into the child. Some brands of tracheostomy tubes, such as Shiley, use air to inflate the tube cuff with. Other brands, such as Bavona, use water, sterile water, to inflate the tube with. Continuing to prepare for this tracheostomy change, it's important to have an oxygen monitor called an oximeter on the child so you can monitor heart rate and oxygen saturation. Although when they're very active and crying, it doesn't always work out so well initially, but it's good to have a monitor to help you assess. We also have a stethoscope available so that we can listen to the child's lungs after we change the tracheostomy tube to ensure that we hear air entry on both sides of the chest. You may or may not be prepared to use a stethoscope and listen to it. You will know your home oximeter and how it functions for you and how to look for a reading afterwards. Always remember, look at your child. Look at your child's face. Are they looking at you with fear? Are they looking at you with color change? Those are the things you want to look for first before you start fumbling for other equipment should there be any difficulty with the routine tracheostomy change. We would like to, for the active child, which my little guy isn't very active today, have a blanket wrapped around the arms to keep them out of play so little hands don't go grabbing at things. We also, in the infant child, do want to have the neck exposed. We'll put a roll under the back of her neck so her head exposes the area we're going to work with. We don't want to hyper extend the neck, but we would like it back a little bit more than just straight so we can look at this area. We want to make sure that we either remove clothing or move it out of our way so that we expose the chest and we can see the chest. So now we have our oximeter on and working. We have our chest exposed. We have all our supplies here. We have our new dressing. We have gauze that we've moistened with a little saline so that we can use it to wipe the site. When you remove the old tube, for those seconds that you have one tube out before the second new tube goes in, that's your opportunity to look at that stoma site. Think about it like a clock. Midnight, 6, 3, 9. Stare at that site, wipe it briskly, and notice if you see anything there. Red tissue, white tissue, perfectly round hole, egg-shaped hole, whatever it is you see, that's your moment to look. If your child is not on a ventilator and can breathe comfortably through the stoma, through the upper airway, you'll have more time to assess the site. So it's individual as far as how quickly the trach needs to come out and go back in.
Performing a routine tracheostomy change. Preparation.
In the tracheostomy tube evaluation tool that we're using today, developed here at Boston Children's Hospital, we do recommend pre-oxygenating the child with oxygen. You would need to check with your physician to find out if that's appropriate and thus not contraindicated for your child given their diagnosis and disability. So we will add oxygen to either the ventilator circuit, the trach mist collar, perhaps the heat moisture exchanger for a couple of minutes prior to changing the tracheostomy tube, just to give us a little bit of time if when it comes out it's more difficult to put the tube back in. It'll keep the child's body saturated just a moment longer. So what I'm going to do is I'm going to put on my gloves because this is a clean procedure. And they would normally come out of a box and we would wash our hands in Purell first. I'm going to have a second person here. So what we're going to do is remove the dressing that was on there before. This is a type of dressing called Exudry. This allows us to look at the site a little bit. I'm not going to take Q-tips now and gently take the time to clean the site because I'm taking the tube out and I will wipe the site while it's exposed with my gauze that has moisture on it. You would like to prepare your trach tie in advance so you know the length. It's good to measure the distance of the trach tie that's on there so that you can pre-cut the next one for next time. I'm going to open up my tracheostomy tube. I've verified the size and that it is cuffed. And something called the timeout procedure is used within the hospital setting, and we have two people verify that, who we're changing the trach on, do we have the right tube. So it's very important when you and the other person are getting ready to change the tube. Obviously, this is your child, and you're quite sure of that. But please do have two people look at the tracheostomy tube and assure that it is the right size that you're placing in. Sometimes you get a lot of deliveries, you have a lot of equipment, and things can get mixed up a little bit. So I'm going to remove it from the package, but I'm not going to touch with my gloves the part that's going to be inserted. What I'm going to do is take a syringe, and I'm going to inflate the balloon on this tracheostomy tube. I want to assure that it inflates properly and evenly around. This Bavona tracheostomy tube has what's called tight to the shaft technology, so you see that when the tube is deflated, you really don't see the balloon at all. Let me open it again for you. So we've just stretched it out to make sure that it's stable and competent, the tube. I'm going to remove all the air. I did mention to you that Bavona uses water, but for testing purposes, air is fine. It will be filled with water when it's in the child. This other device that you see, this other little piece of plastic here, is called an obturator. And this helps keep the tube, you'll see that the tracheostomy tube is very flexible. And if I try to insert it, it might bend and crinkle up upon itself. So this obturator is provided to keep the tube firm during placement. Once this is placed in the child, this should be immediately removed so the child can pass air through the tracheostomy tube and be placed either back on their ventilator or on oxygen or mist, whatever they were breathing prior to the change. So we'll put the obturator back in. And I'm laying it in its original sterile package. Then I will take a tube or a packet of my water-soluble lubricant, drip a little bit into my sterile tracheostomy tube container, and dip the tube in the end. Don't need too much, just a little bit at the end of the tube so that it will easily slide in and out of the stoma. So the role of the second person with this regard to this trach change is to hold the tube in while the ties are removed, remove the tube when the person that's going to replace the tube directs you to do so, and help hold it in place until everything is secured. We also have arms and feet sometimes to worry about, so we talked about papoosing or wrapping a blanket around the arms to keep them down at the side. So we have pre-oxygenated the patient or the child to have full saturation of the blood in the body and give us a little time before desaturation occurs should we have trouble getting the new tube in. And that would be by your doctor's prescription order. We have prepared the new tube. It has been checked for its cuff integrity, and it has been dipped in a little bit of water-soluble lubricant to make it easier for insertion. We have our trach ties here available, the new ones to put onto the neck after we've inserted the tube. And I'll show you the way I like to do it. Totally up to you, what your preference is. We have a moist piece of gauze so that we can wipe the neck while we're observing for that moment between the old tube coming out and the new tube being inserted.
Performing a routine tracheostomy change. Procedure.
So you must sort of imagine that I've got two people here. The child has been papoosed. The neck is exposed. We're going to remove the old trach ties, and kids don't like your hand over their eyes like I'm doing right now. Remove the old one. My second caregiver is holding on to the tracheostomy tube and assuring that it's not going to be dislodged. We have a syringe to remove the water from the balloon if there is water in there, if it is inflated. And when the second person you're with that's going to insert the new tube tells you that they are ready, you're going to make sure that you have good oxygen saturation. The child is ready. If there are a lot of secretions that you feel or the child is coughing, You would want to pause and suction the tracheostomy tube to clear secretions before you change it. We will take the new tube, and the person that's removing it, will tell them to remove it. They will remove it. We look at the stoma, we wipe the stoma, we insert the new tube. We hold the tube in, we remove the obturator, place the child back on breathing support or supply oxygen. If they're not on either one, that's fine. Just let them breathe through the tube, settle out for a moment, and then we will deal with putting on the new ties and the new dressing. We do want to observe coloring of the child, facial expressions. We would like to use our stethoscope to listen for air entry, if that's something that you're comfortable with and have in the home.
Types of tracheostomy tubes.
I just wanted to review with you the types of tubes that we are currently using here at Boston Children's Hospital. And that would be the Shiley and Bavona tracheostomy tubes. This is the Shiley adult double lumen cannula tracheostomy tube. This is the obturator that we spoke of earlier when we looked at the other tubes. So after the tube is placed into the patient, there's a locking inner cannula. You can see the tracheostomy cuff on this tube. This is deflated. And I'll show you why that's a little bit different in the other type of tube we have here today. So I inflate the cuff, it's an air cuff, and I deflate it. When the tube is in use in a patient, if the tracheostomy tube becomes plugged with secretions, you can take the inner cannula out and remove the plug, thereby allowing the patient to breathe, replacing the inner cannula with another one, or cleaning this quickly and putting it back in place. That is the major advantage of the adult Shiley double lumen tracheostomy tube. The sizing doesn't allow it to be used with infants and small children. It's available only in a 5 inner diameter and up size. These are Shiley tubes for pediatrics. This has no cuff. This is cuffed. You'll see the difference on them. And again, this is the air cuff so that when it's deflated, it still does protrude into the airway a little bit. They both have their obturator as well for insertion. These are the Bavona tight to the shaft technology. This is cuffed, this is uncuffed. The flange comes available in both a straight and a V fashion. We don't carry the V fashion here at Children's, but it is available from the company. And as you saw earlier, this is what's called tight to the shaft technology, so that when I inflate the balloon, it appears. When I deflate it, it disappears. Comparing the Shiley and Bavona with cuffs, the Shiley, you can see that the cuff is still protruding even though the air has been removed. So in some cases it may be a little bit more difficult to pass through the stoma. In addition, when it's in the airway, if the child can pass air around the cuff and is allowed to speak or use a speaking valve, then this is an area that may block some of the air coming out up through the nose and mouth and may make it a little more difficult to talk. It's very individual. Certainly please discuss this with your provider. We do also stock the Bavona Flex 10 tube, and the purpose of this tube is for, like our little guy we were using today, when infants and children have very little chin space, and at times it's important to provide them with a tube that has a little bit of extension on it, especially those children on ventilators that need then to be connected to something else here. But whether they have a ventilator or not, the cuffed and uncuffed Flex 10 tube is available to aid in reducing the amount of erosion and irritation of the chin and upper neck here from having a tracheostomy tube in place. For example, you can see the difference of how that may help the child if they're having difficulty with it rubbing against the neck. So please do discuss this with your respiratory therapist, your physicians, your otolaryngologist. about what tube best suits the needs of your child. And that need may change. It may change whether they're on a ventilator or not on a ventilator. It may change by the type of ventilator they're on. Some work very well without the added cuff. Some do not. And it really depends. So I urge you to please ask the questions, receive the answers, and then make decisions for your child.
Performing a routine tracheostomy change on a child.
Today we have Drew, who is 5, and her mom April with us, and we're going to perform together a tracheostomy tube change and help you to learn how to do it with your child. We are following the Children's Hospital Boston guidelines for the tracheostomy tube change, so I will review the procedure and the equipment that we have here in preparation for the tube change prior to that change with Drew. Drew is on her home oximeter with saturation and heart rate, and her home suction machine is here and charged, ready for use with the appropriate size suction catheter for her tracheostomy tube. In addition, we have our self-inflating bag with pop-off and our mask that's appropriate for Drew in the event that she should need that. We have our water-soluble lubricant to use for the end of the tracheostomy tube to ease insertion. We have sterile water as her tube has a cuff or balloon on it, so we need that for inflation of the tube. We have syringes to do the inflation with that water as well. We have gauze for her tracheostomy tube dressing, and gauze also to wipe the site when April examines the site after she removes the tube prior to inserting the new one. We have Drew's tube, her 4.5 pediatric FlexTen tube, and we have a 4.0, the next size down smaller. In the event that there were any difficulty getting it in, we would just immediately grab the smaller tube and put it in place. We have Drew's trach tie for her tube holder, and it is already preset by her mom April for the exact length that she needs for her tube, and that will be placed on after the tube is put in. We discussed earlier that there are different preferences by different folks. Some choose to put the tracheostomy tube tie on the trach tube before insertion. Some choose to put the gauze on before insertion. Others do it after. It's important to evaluate the child for the need for suctioning prior to the tracheostomy tube change. Drew is very clear of secretions right now, so she doesn't require that. We do have a stethoscope available. Some families do use the stethoscope to assure tube placement after it's inserted. Others do not. Like we spoke about earlier, you really want to look at Drew's face and see, does she look comfortable? Do her lips look pink? Is she looking any distress? Is her chest going up and down? Look at her, not at the equipment. The trach change procedure at home is a clean procedure, not sterile. So April and I have clean gloves on. She will, however, not touch the part of the tracheostomy tube that's going to be inserted, or try to avoid that, into Drew. But the tube needs to be checked for the cuff inflation and examined to make sure that it looks like it was made properly. So April's going to now insert air into the Bavona cuff to see that it inflates, and actually you can see sometimes it opens a little crooked and needs to be stretched out once or twice. Water is the company recommended solution to put in the cuff while it's in use, and that's what will be used with Drew once the tube is in her, but for testing purposes the air is fine. The obturator is now being placed in the tube to help keep it firm for placement into the stoma. And April will put some water-soluble lubricant into the sterile container to dip the end of the tube in. Also in the package with the tracheostomy tube comes the wedge, or what I call the tooth, and this is a plastic device that helps detach the tracheostomy tube from the ventilator tubing. If you ever have difficulty getting them apart, you slide the wedge in and it helps and assists you with getting them apart so that you can then hand ventilate or whatever you need to do. April has the split gauze trach dressing for Drew, and she's got that now open and ready, and she has extra gauze to use to wipe the site between removing the tube and replacing the tube if there's any soiled secretions or anything there to be removed off the site. And remember that when the tube comes out of Drew, that's mom's opportunity to take a look at that stoma site and think about it like a clock, 12 o'clock, 6 o'clock, 3 and 9, and see if there's anything. Pink tissue, white tissue, is it perfectly round, is it egg shaped, whatever she happens to see in that very quick moment. Drew is on a ventilator, so timing is of the essence, and she can't, as we talked about with other children that maybe aren't on a ventilator or can breathe out their nose and mouth in addition to it. We don't have that time to really just look at that stoma site. We're going to look quickly and insert the new tube. April's going to put rolls underneath Drew's head. We talked about the rolls so that we can see the neck. We don't want to hyperextend, but we do want to expose her neck. So April's, her mom, going to put, should mom going to put rolls under your neck? Yeah. So they're really under her shoulders, raising the back of her neck so that her head is pretty much still midline, but her neck is exposed. As per our protocol that we're following here at Boston Children's Hospital, we do provide a couple of minutes of oxygen for children that are on Romair, as Drew is. So she has been provided with oxygen through her ventilator prior to the procedure. In the event that we have any difficulties, it would give us a little more time to get the new tube into her and help her with her breathing. Please do check with your own physician and find out if that's medically indicated or contraindicated for your individual child. I'm going to remove the Velcro ties because I'm the assistant here. When we do an elective trach change, we have 2 people, Drew, don't we? We want 2 people, mommy and somebody else, or daddy and somebody else. I'm going to secure the tube in place. I'm going to remove the water that's in the cuff right now, and you're going to get louder. Okay, and I'm going to wait for April's signal to remove the tracheostomy tube. Okay, honey. Get that off there. Get that one off there. Are you ready? Okay. When you tell me.
I'm good.
Okay, there we go, sweetheart. The stoma looks excellent. Round, no white, no granuloma tissue, nothing. That is very, very... The tube is inserted, the obturator is removed immediately, and Drew is placed back on the ventilator. Wonderful, sweetheart, we're all done. I'm going to hold the tube in place so that her mom can get the dressing ready. However you want to do it. Okay. Good girl. We see that she's as comfortable as she has been the whole time she's been here. Her heart rate and oxygen saturation are normal. She is glowing pink from the additional oxygen, most likely. And we do have our stethoscope so that we can assure placement as well. Okay, so now that we have the trach tie in place, I'll put my finger under there and, ooh, a little bit snug, but I've got my 1 adult finger underneath. So we want to make sure it's not too loose, allowing it to fall out, and not too tight, keeping her face red for all day, right? And I have the water, 2 cc's of water. This was in your balloon before. I'm going to put it back in, okay? And you'll still have your voice, though. Yeah. Okay? We'll take that roll out. You don't like that. Okay. Good girl. Give a smile to the camera. Tell everybody you're okay. Huh? Give them a yes. Can you nod yes, you're okay? I saw you do it with your mouth before. Yes, good. Wonderful. Thank you so much for coming today, Drew, and helping us with this trach tube change so other mommies and daddies and caregivers can help when they change trachs on little girls and boys too.
Please help us improve the content by providing us with some feedback.